Hi, this is Dr. Cliff Gronseth coming to you, another Dr. Cliff's Riffs. We've had a lot of questions about the Medicare sign-up period, the Medicare versus Medicare Advantage plan. So I thought I would just take a few minutes to explain from our perspective a fairly simplistic way of looking at the differences in the plans that may help you decide what's the best plan for you. As you know, there's many different Medicare plans. Plan A, B, C, D, F, G, and you know the alphabet soup gets a little confusing. The bottom line is A represents hospital costs, B are the outpatient services and physician costs, C are the Medicare Advantage plans, all bundled into Medicare C. D have to do with drugs and the pharmacy benefits. F is a plan that's offered to people prior to 2020. It's no longer available for new enrollees in Medicare, but if you have Medicare F, you can continue that. And then Medicare G is designed to replace the plan F, and the Medicare G stands for Medigap in a sense, which pays for the uncovered costs of that plan A and B don't cover in general. There are some costs that G does not pay for, such as the outpatient services, deductibles, and things like that. But basically G replaced F because F is no longer available unless you already have it. So all those alphabet soups makes it quite confusing, and it's really hard to get your head around it. The Medicare Plan C is really the Advantage plan system, and that basically is designed to simplify the complexities of the Medicare plans, and it bundles everything into an insurance company's kind of house. So let's just say the private insurance companies like United or Cigna or Aetna, Kaiser, they may have Medicare Advantage plans that they offer inside of their private insurance system, and they basically kind of eliminate some of the administrative complexity because they bundle the pharmaceutical plans, the Plan D, they bundle the hospital and the outpatient costs, and they try to just basically simplify the system for people. They also offer some extra little benefits like dental, eye, hearing tests, and other little perks that they'll throw at you. But the concept of the simplification comes with potentially some costs. There are the prescription drug plans are sometimes negotiated by insurance companies, which can be less expensive for people that sign up for the Medicare Advantage plans. However, now President Trump has offered some types of reductions for some plans, for some drugs, I should say, and so we'll see what happens with that. But the drug coverage is sometimes bundled into these Medicare Advantage plans, again with the idea that maybe you can have some cost savings. And so the whole idea is that maybe the premiums are less, the simplification is easier, so it does seem quite attractive. The one thing about the Advantage plans that people should know about, however, is that there are different offerings or different benefits inside of each of the plans, and they can sometimes change. One of the limiting factors for the Medicare Advantage plans is that you may have some limited provider network coverage. In other words, if your doctor is not in, say, United or Kaiser or some other kind of Medicare Advantage plan, you may not be able to have access to them. Or if the hospital is not covered by that insurance company, that may not be part of their system. You may have to go to a different hospital, etc. So there's basically a fence around some of the care that you get with the Advantage plans that you wouldn't otherwise have with Medicare, which is much more open. Providers and hospitals that accept Medicare will take you regardless of where you are in the country. Medicare for the most part, does not have significant prior authorization or denials of coverage. They have a standard list of what they cover. They publish that every year, usually in the fall. And next year, they're starting to implement some prior authorization for services. But for the most part, the Medicare coverage is well defined and there's no surprises, unlike the Medicare Advantage plans, which may say, well, that's not really part of our Medicare plan. So if the care gets complicated or complex, the Medicare Advantage plans may have some restrictions or some hurdles to jump over for prior authorization, denials, etc. Medicare is a fairly open plan. You get what what Medicare covers from the get-go. Medicare also has a little bit wider national coverage. So if you're traveling or if you do need care elsewhere that you're not locally, if you already have defined what who your providers are in your region and you feel comfortable with the insurance company that is providing the Medicare Advantage plan, you can almost think of it, the Medicare Advantage plan, as being a private insurance plan that's inside of their network, but it's under the rubric of Medicare. The Advantage plans may have a little bit more limited coverage than the Medicare plans, which tends to have a fairly national coverage. The other disadvantage of the Advantage plans is that there may be some dropout or changes in plans and year to year, and so it's a little bit hard to know what's covered, what's not. So for the simplicity and the all-inclusiveness of the Medicare Advantage plans, you may be losing a little bit of your freedom. You also definitely lose some of the choice of providers. Again, if your provider is not in that Medicare Advantage private insurance system, it may not be part of, you may not be able to see them where they will pay for it. So the idea is that if the healthcare gets a little bit complicated, which is really what insurance is about, it's to cover you should things go awry. The Medicare is much more forgiving. It doesn't have as many hoops to jump through. It doesn't have any kind of prior authorizations, except for a few things that are coming in 2026. The other thing about the Medicare Advantage plans is there's something called Medigap, which is that Plan G or Plan F for people that signed up prior to 2020, 5 years ago. But the new enrollees, the Medigap covers the percentage that Medicare does not cover. Medicare typically covers 80% of the cost, and then the Medigap pays for that remaining 20% of costs for either hospitals or outpatient services and things. And so the Medigap does need to be obtained by individual or separate insurance companies. And if you have a complicated Medicare situation, complex medical health, you may not be able to switch from a Medicare Advantage plan to regular Medicare because you may not be able to get the Medigap insurance, which again covers that remaining 20%, which is not covered, that Medicare does not pay for. So think about that when you're signing up for your plan. The other thing is the negotiated drug prices. As I mentioned, President Trump indicated that he might be working on a plan that reduces some of the drug costs. Plan D, as you've heard, which applies to the Medicare drug plan, has the donut holes and all of these other rules and regulations, and it can get quite complicated. The Medicare Advantage plans tend to be, they have their drug network, they have their costs, etc. It's whatever the Medicare Advantage drug plan allows for the most part. So you have to stay, again, inside of the Medicare Advantage system for your drugs to be covered, etc. Medicare Plan D is a little bit more open, but it may be a little costly to you. So the bottom line is that Medicare provides a little bit more stable and reliable access to your health care. It's more complicated. It has less restrictions of rules for providing your care. So there's really no doubt about what's covered and not covered. You don't have to ask for permission or for the authorization to get certain types of services. And what they found, interestingly, is that the Medicare Advantage plans, even though they're supposed to offload some of the burden from Medicare, they actually have cost the government slightly more money in general than just straight Medicare plans had the enrollees stayed inside of Medicare. So I hope that explains a little bit about the complexities of the two systems, Medicare versus Medicare Advantage. The one is a little bit more open. Medicare is more open and has less restrictions and prior authorizations, less limitations. The Medicare Advantage may have some extra little perks that would be beneficial depending on what your situation is. However, I would not necessarily compromise kind of the simplicity of a Medicare Advantage plan, say, well, it's all in one house, it's all under one roof, so it's easy to navigate, because with that may come a cost of some restricted care. So I hope that helps. If you have any questions, certainly come in, we can talk about it. Your insurance representative can also discuss the issues with you. The insurance salespeople do have financial incentive to sign you up for the Medicare Advantage plan, so a little caveat emptor about if they're biased about promoting a Medicare Advantage plan for you out of the perks and the simplicity that I talked about. Stay well. We'll see you next time. Thanks so much for your support. Take care.